stop what you're doing. Right now, stop. Here's a lesson for you guys. You may be going through something terrible. There might be going something on in your household, but don't feel like you're alone, because I've been where you are right now.
Toriana Affernorp suffered from depression and was struggling to cope in a new environment as a teenager at Warrenton High School. She found the support she needed with Melinda Talbot, a marriage and family therapist with Clatsop Behavioral Health Care. Melinda is able to meet with students like Tori on site at the high school thanks to a grant from Oregon Health Authority through the school-based mental health program.
So it's really important because it provides so many resources that they just don't have, and it doesn't cost them anything to be able to utilize it. It just takes their willingness and desire to come in.
Clatsop Behavioral Health Care partners with Warrenton High School to provide immediate on-site school-based mental health treatment, crisis services, and supports for children, youth, and families. The services are delivered in a way that support a young person's gender identity, culture, language, and values, and are provided in a way that is trauma-informed and developmentally appropriate, which helped Tori overcome her nerves the first time she sat down with Melinda.
We sat down, and I was really nervous. And she's like, don't be nervous. And I was like, I know, here I am, dressed like a professional, ready for a job interview, But Melinda helped me ease my way into therapy. Because at first I thought I didn't need therapy. But going through that process of therapy really helped a lot.
Workforce staffing shortages of mental health professionals, school counselors, and school social workers continue to impact programs across Oregon, particularly in rural and frontier areas of the state. Jamie Clevey, the school counselor at Warrenton High School, understands the importance of having Melinda in the school for her community.
Kids come to me first, and I tell them I'm not a therapist, but I can get you to one. And the best part about getting them to Melinda, or now we're having Meredith come in, is that it's here. They don't have to drive to an appointment with gas money that they don't have. They don't have to take time off of work to get their child to therapy.
Since 2014, the Oregon legislature has provided direct funding to 14 community mental health programs to partner with rural and frontier schools and districts across 16 counties. Fran Pearson, the school-based mental health program and policy coordinator for Oregon Health Authority, understands that offering services to young people where they are 5 days a week makes it easier for kids because it can feel natural.
They know their teachers, they know the hallways, they know the setting, and it feels comfortable for them to be able to talk to someone about things that they're struggling with.
In the last 5 years, more than 7,000 students have been seen for mental health treatment through the school-based mental health program.
I've had kids that teachers brought in on the fly, suicidal, talking through stuff, and able to help them to get the help that they needed and the support they needed to work through those feelings instead of wanting to go hurt themselves.
It's critical to provide these services while they are young. It helps them learn coping skills so that they can attend college, so that they can get a job. It helps them emotionally self-regulate so that they can have healthy relationships. School-based mental health programs strive to create supportive pathways that help students stay connected to school, graduate, and feel more prepared for a successful adulthood with coping tools and connection. These services are also critical for local communities. Many families are often faced with going to an emergency department that can be hours away to access immediate mental health services and at a time when they are in crisis. School-based mental health services support attendance, learning, connectedness, but they also reduce the burden on already overwhelmed emergency departments and hospitals. These programs provide early intervention and prevent the need for intensive services.
It was an advantage for me because not a lot of kids my age are given the resources around them. And so they tumble down darker into the darkness, into this dark hole, and there's no light. And so when they want help, they can't get it, and it's really sad for the kids who aren't able to get the resources that they needed. And in my future, that's what I want to do. I want to help the kids that don't have the resources have them.
Tori is on her way. She's started college and is studying art therapy so that one day she can be the one reaching out to a child in need. Oregon Health Authority's hope for the future is to broaden the school-based mental health program to include youth peer support services and find additional community-based and culturally specific organizations so they can continue to reach the right people at the right time in the right way.